Hi, I'm Andrea Lana Season, and today we're going to be diving into a significant public health concern, which is congenital heart disease. Together, we'll explore what this condition is, its risk factor, who it impacts most, and most importantly, how we can prevent it or reduce its effects. So first, let's define our topic. What is congenital heart disease? Well, congenital heart disease, or CHD, results from blocked arteries, often leading to heart attacks. It can be present from birth and can range from mild to life-threatening. This can be a significant public health challenge. CHD is one of the most common birth defects, affecting nearly 1% of births per year, or around 40,000 births. Over 2 million individuals in the US lives with CHD. So let's take a moment to share what you think about how public health can help manage these lifelong conditions. Do you know anyone that has any heart condition or heart disease?
Personally, my grandfather has a heart condition, and when we went to the doctor, they said that to mitigate that, you should mainly eat foods with low cholesterol content and high fiber, and also engage in the exercise you can reasonably engage in, especially at such an old age, some low impact cardio.
Yeah, perfect. So I will actually be talking about and prevention later on in this presentation. Thanks for that. Okay. So what puts you at risk or what should you look out for? Congenital heart disease is often linked to genetic and prenatal factors. It also includes factors like lifestyle choices, like smoking and lack of exercise. Some of the genetic factors could be like family history, which increases your likelihood of having CHD, and symptoms of this can also vary depending on like the type or severity of CHD. So mild CHD is often asymptomatic, which means that it doesn't really showcase any of the symptoms and can only be detected through routine screenings. Severe CHD symptoms can include rapid breathing, fatigue, and like cyanosis, which is bluish skin. Long-term complications of CHD are heart failure, arrhythmias, and delayed growth. So, congenital heart disease affects a diverse group across the US. When considering race and ethnicity, disparities are clear. Black adults are disproportionately affected compared to their white counterparts, whereas 47 of Black adults have cardiovascular disease compared to 36% of white adults. Gender differences also exist, with men showing a higher prevalence rate compared to women. Finally, age plays a role with notable increases in younger adults in recent years. These statistics highlight the importance of targeted intervention and awareness in managing CHD risk across all demographics. So, prevention and healthy habits. Preventing congenital heart disease involves adapting healthy lifestyle habits, like you said, and managing these key risk factors. These include like diet and exercise, consuming, again, like you said, the nutrient-rich food, staying active to help keep your heart strong. Monitoring and controlling your blood pressure, cholesterol, and blood sugar levels are also important, as these can significantly influence your risk. Additionally, avoiding harmful habits like smoking and limiting alcohol intake can further protect your heart. Finally, regular checkups with your healthcare provider are essential for early detection and proactive management of any potential issues. Prevention is truly the best medicine. So, what steps can parents and communities take to promote early detection? Let's think about actionable policies or personal changes. What do you think could be an example of like policies as like a public health policy that was passed to control diseases or like heart disease and stuff like that?
Well, from what I remember from my personal experience, in the US education system, I remember when there was a shift in, the nutrition that, public schools provide. They had more balanced meals and, overall less fatty foods, less oils. I think it was due to Michelle Obama's act. I'm not sure what the name is, but that is an example of a nutrition policy aimed to prevent such diseases like congenital heart disease.
Okay, yeah, perfect. So that policy is actually the Healthy Hunger Free Kids Act of 2010, where school lunches provided are now healthier, so they substitute like with fat-free milk or like whole grain alternatives of the usual school snacks. But yeah, perfect. Okay. So now that we've covered CHD and its impacts, let's open the floor to any questions. Please feel free to ask anything about the information I shared, and I'll do the best to answer them.
I have a few questions. I was confused. What's the difference between coronary heart disease and congenital heart disease? What's the difference between them?
Great question. So, congenital heart defects or like congenital heart disease are structural heart problems from birth, which can affect the blood flow through the heart and the body. Coronary heart disease, on the other hand, typically develops over time due to factors like high cholesterol or smoking. So, the main difference is that when you contract it. So congenital heart disease are usually present from birth, while coronary heart disease typically develops over time due to like factors like high cholesterols or smoking.
Thank you. That makes a lot more sense. Speaking of the risk factors that you mentioned earlier, what are some common risk factors, especially because, like I mentioned before, I have family with, just I'm not sure if it's specifically coronary heart disease, but heart disease in general.
Yeah, so key risk factors include like genetics, as like we mentioned before. So like family history of heart disease, maternal health conditions like diabetes or obesity during pregnancy. Also, like if the mother smokes during pregnancy, that could also be one of the risk factors. Environmental factors, which like again the smoking and alcohol usage. Also, we also talked about a little bit on the slides on vaccination. So sometimes heart disease can come up to a newborn if the mother isn't properly vaccinated. Sometimes these viral infection can cause heart disease to the child